All right, so today we're going to be fitting a post-operative knee immobilizer, and providers will prescribe this typically when trying to keep the knee from moving after a surgery or acute injury. First thing we're going to do is going to slide it underneath the leg, like so, making sure that the uprights are on either side. Next, we're going to make sure that the hinges of the brace are on either side of the knee, midline and center, or slightly above. Just like so. Make sure the uprights maintain their position. Good. Next thing we're going to do is make sure that the uprights are long enough. You want them as long as possible without impeding the patient's gait pattern. So from here, that's pretty good. That's as far as it goes down. This position's very good. This one's good, and I don't really want to bring this one up any higher than that. If you do change anything on the upright, you want to make sure that you do the thing that you do for one side, you want to do to the other. So if you change something here, change it here, make sure each one matches. Next, we're going to clip him in, like so. Good. And this is Velcro, so it will stick to everything. Put him in on this side. And so when you're clipping him in, the uprights can get wonky. Just make sure that they are in their correct position before you start tightening down. And then we're going to start at the bottom and start tightening down. There's different types of immobilizers. Right now we're teaching you on the DonJoy. This one, you have to pull the Velcro and the strap apart down here, tighten it up from the back, lay it back down on top of that Velcro, pull it through the strap, and making sure that it's tight and snug. It shouldn't be so tight that it's constricting blood flow. A good way to make sure it's doing that, it's not doing that, is by sticking 2 fingers in between. If they can fit nicely, that's good. If you can fit 3 fingers in, however, that's probably too loose. You should tighten it up a little bit. It comes with this fancy strap, Velcro, so that you can cut the straps down to the size and to the shape of the leg. I'm not going to do that right now for training purposes, so I'm just going to fold it back, lay it down, and lay it down there. Same thing here. You're going to do this 4 times. Down. Making sure those uprights stay in the correct position, and lay it down behind. Same thing up here. Tighten it up. Cut down the straps to what you need. Put this back on and lay it down behind. And lastly, this top one right here. Good. Now that it's in the correct position, uprights have stayed center line with the leg, hinges are midline with the knee or slightly above. Now you can set the range of motion parameters that your provider has given you. Let's say they give you a 90 flexion, -10 extension. There is a gauge on this right here that you can move. You move to the 90. -10. Do the same thing on this side, 90, -10. He will no longer be able to move his leg past 90, and then he has no range of motion restriction on the extension, so he can go into full extension. Now, your provider may also say that they want the brace completely locked out during ambulation or at home when they're resting. To do that, there's these two buttons on the hinges right here. To press that downward, you'll hear it click. Do the same thing to the other side. Hear it click. He will no longer be able to bend the brace. And that is how you fit a knee immobilizer. That's how you fit it to the patient. Now, some things we need to watch out for are hot spots that may grow, uncomfortability. If the patient's not comfortable, they're less inclined to wear it. So you may want to make sure it's as comfortable as possible. Hot spots may show up if there's some rubbing on the brace in an inappropriate area. If any of that occurs, have the patient come back in, to see either the provider or someone who could help fix the brace to the position it needs to be in. Do not allow them to continue if any hot spots are occurring. To clean it, straps and pads, use warm soapy water, let it air dry. Plastic uprights, hinges, you can use a disinfectant wipe or some rubbing alcohol to clean those. And that is the wear and care for the knee immobilizer brace.